A vast amount of people in India live below the poverty line. 30% of India's population live without medical insurance or any medical protection. Hi, my name is Shruti Konda, and this is what I have done with TFG over the course of 1 month. I have always been interested in the topic of medicine. Health is something that I realized I wanted to learn from a pretty young age. The biggest fear and issue that I had was the fact that I could not stand the sight of blood, and that caused a big fear of medicine in me. Moreover, I didn't really like talking to people who I didn't know, basically being quite shy. Thus, me and my family found out, that this is one way that I can slowly ease myself into the field of healthcare and medicine, learn about the problems that many people face in India all the time, and learn how to talk to people so that I can gain an insight into their lives and more. India is divided into many socioeconomic statuses, which affect the quality of services in life an individual has. One of the biggest issues present is the low income levels of people. Healthcare costs in 2021 in India rose by 14%, being one of the highest in all of Asia. People are not able to afford healthcare services. There's a major lack of infrastructure and a lack of accessibility and a lack of knowledge within people. They don't know what to do if they're sick. They don't know what's happening. And if they do, they aren't able to access the required services in time. In one of the first classes we ever had, our group mates decided to try and find out what the problem was as part of an activity, the cause and the consequences. All four of us had one common issue that we found, and that was the lack of knowledge and the having low income. Therefore, our two virtual fieldwork sessions were us working with the Think Sharp Foundation, where we'd create presentations and teach and explain to a group of kids about different topics in health. Since we had only two, the first one was about puberty and the changes that they might expect and how to take care of themselves during this time. We had to facilitate the entire thing in Hindi mostly in a 45-minute session. The second one we had was about epilepsy and trying to remove any misconceptions and stigmas they might have had about it or anything myths that their parents might have told them. My community project was writing a research article about the impact different socioeconomic factors have on malnourishment rates of mothers and children in India, covering the aspects of what malnourishment is, socioeconomic statuses, and how it affects the rate of malnutrition by giving data from NFHS surveys and studies from the Lok Sabha, the prevalence of malnutrition both globally and in India, and the reasons for such socio-economic inequalities being present, and a list of government programs that have been implemented in order to try and reduce these rates in India. In the long run, I want maybe 20 to 50 people to actually read my research article. In fact, I plan on taking forward and developing my research paper skills and writing skills by writing another one with guidance of my teachers, and this time try to include primary data as I could not really include it in my research article this time. The low income levels, the lack of infrastructure, and the lack of knowledge are very major issues that the healthcare system of India has. Only by taking small steps, such as teaching people about how to maintain a good diet or what being healthy is, can we slowly start having a better life for all.